Good afternoon. I'm Michael Della Carpini. I'm Dean of the Annenberg School, and I bring greetings from my gender. It's a great honor to introduce today's keynote speaker. As you know, it takes a lot to build a great university and maintain a great university. You need students who are committed, diverse, talented, and who become contributors to society as alums, as they live their own fulfilling and meaningful lives. And we have that, both the alums and the students here at the University of Pennsylvania. It requires a faculty that are committed teachers and talented researchers, great mentors, and we have that here at the University of Pennsylvania. It doesn't hurt to have great public space and wonderful facilities, and as you can see from this room, as well as elsewhere around the campus, we have that at the University of Pennsylvania. And it really doesn't hurt to be located in a world-class city such as Philadelphia, and as we are here at the University of Pennsylvania, thanks in no small part to the work of Midge Rendell and her husband. But in order to make those ingredients mix well, you need great leadership, and we are blessed to have great leadership here at the University of Pennsylvania. As some of you may not know, but as I've been able to know because my own research area is actually very close in some ways to Professor Gutmann's research, she is a world-class scholar. Her work and her work on deliberative democracy and other aspects of political theory and democratic theory has been truly influential in the academic world. And I won't go through the litany of all her work. I'll just let you know that as someone who has been influenced by her work for many years, we are lucky to have her on the faculty and leading here at the school. But in addition to this, and as I'm sure most of you know, President Gutmann has been a tremendous leader, a visionary leader, as Afaf mentioned, but also a strategic and practical leader of this university, and we are extremely lucky to have her as we move forward in the 21st century. To quote the immortal words of the American baseball player Reggie Jackson, she is the straw that stirs the drink, that is the University of Pennsylvania. So without further ado, please join me in welcoming President Amy Gutmann.
Thank you, Michael. Good afternoon, everybody. It's great to be here, really great to be here. And I would like, on the behalf of the entire campus, to welcome you to the University of Pennsylvania. My excuse for coming in so last minute is that I was actually downtown at a great gathering of the Coalition of Community Schools, and that also is rooted in this wonderful university. But I am truly honored, and Penn is truly honored, to host this 18th Congress of the International Council on Women's Health Issues. And I have to say that were it not for my incredible Dean of Nursing, Afaf Melis, I wouldn't have the partner that really cares about all of the issues that this wonderful organization cares about. So, Afaf, thank you so very, very much for your leadership. And I want to ask you to please join me in recognizing all of your peers and thanking all of the committee members who organized this year's events. Thank you so very, very much. So standing here today, I am both inspired and truly energized by all that women around the world have achieved during our lifetimes. And when I was thinking about the really historic issues that we are tackling in this conference, I had this image. And the image was the following. So I ask you to join me in imagining this. Imagine in the front row, and let's say in that reserved seat over there, imagine Jane Addams sitting right there in the front row. Now, Jane Addams was a famous American suffragist. Long before any of us were born, even long before Afaf and I were born, she was skillfully integrating her argument for extending voting rights to women with trenchant observations about women's health, about the environment, and about nutrition. What she recognized was that individual action, yes, it makes a difference, but she also emphasized that individual action alone cannot provide access to transportation, cannot provide access to housing, cannot provide unpolluted air and water, or ensure the availability of safe and nutritious food, let alone provide the whole system of adequate health care. She advocated for public action. The expansion of voting rights was essential to give women more collective control over their lives, collective control over their lives. Securing voting rights was a first step. It was a historic policy breakthrough. But women's journey to control their own destiny had only just begun. That is still true for most women throughout the world. Though some women today have secured some of the means to shape their lives, the end remains. Our journey is just beginning. If Adams were here, I am sure she would marvel at our progress. But I'm equally sure she would remind us that if we do not broaden the scope of our efforts, and I quote from Adams, we shall fail to go forward, thinking complacently that we have arrived, when in reality, we have just started. We are here today, and I am sure the men and women alike are here today because we recognize this fact. We have just barely started. We rejoice, and I think it's important to rejoice, that voices long silenced now reach the ears of policymakers, and more of those ears are now attached to women. And that's a good thing. Yet we also are here today because we understand that though we have made considerable progress, we have not come close to arriving. Every day in cities around the world, women and girls suffer abuse. They are systematically tortured and raped as a war tactic. They are killed for bringing dishonor on their families. They are forced into marriages as children. They are exploited for profit. Many women and girls simply disappear, victims of human trafficking and other unimaginable fates. Millions more girls than boys are not even born because of sex-specific abortions. Maternal mortality, moreover, claims 1 life every minute. The access of women and girls to education, health care, and employment is grossly unequal. Gender equality remains a goal for all nations. Since 2006, the 3 highest-ranking countries in the World Economic Forum's Global Gender Gap Report. Anyone can guess what the 3 highest-ranking countries in having the smallest gap in gender are? Curious. What? No, not Sweden. Norway? Iceland? One more. Finland, you got it. They have closed a little over 80% of their gender gaps, while the lowest ranking country, Yemen, has closed less than half of its gender gap, and a much wider gender gap at that. Women's potential, the potential of half the human race to contribute to economic, political, and social advancement, continues to be squandered by what only can be called, by any theory, gross injustice. We celebrate the advancement of women's rights most fittingly when we dedicate ourselves to the work that remains. And I take it to be the spirit of this conference to do just that. Ahead of us stretches a future filled with daunting challenges, but also with thrilling opportunities for world-changing success. The question, I think, is, will we boldly advance human rights and women's health in the 21st century? Or as I like to put it, will we empower women to change the world? And that means empowering women to improve the lives of men and women, girls and boys alike. To do so, we must advance three things. And that's what I want to focus on this afternoon. We must advance our awareness, we must advance our action, and we also must advance our assessment of what works. And we have to do that so we reach a tipping point, so there is no turning back, as there is no turning back in voting rights for women in democratic societies. It is simply unimaginable today that women would not have the right to vote where they do. We have to do the same thing for healthcare, for education, and for job opportunities. So let's begin with awareness. In this digital age, we have unprecedented access to vast amounts of information. Opportunities abound to learn about and to communicate directly with people who would have been strangers to us a generation ago. The emergence of new technology and the really surging popularity of social media enable us to personalize global issues and to increase awareness of human rights. And we must personalize those issues because otherwise we will not increase awareness. Let me give you an example. Last summer, when a 26-year-old Iranian civilian, Neva Aga Sultan, was shot during a demonstration in Tehran, a bystander recorded her final moments on his cell phone. The footage and news of her death spread rapidly over Facebook, YouTube, and Twitter. I don't know how many of you tweet, but lots of young people do. And it drew international attention to the political protests. Stories like Neva's raise awareness exponentially. They connect statistics and reports with faces and names. When we move from abstractions to concrete examples, both of tragedy and of triumph, the urgency of the global women's movement crystallizes. It crystallizes not only in people's minds, but in their hearts. Awareness fuels action. So first, awareness of urgency, then action. Over the past decade, grassroots initiatives and collaborative partnerships to empower women have sprung up around the world. My favorite examples, of course, have Penn roots. So you'll excuse me for my Penn-centric examples, but I would say to all of you and the institutions you belong to, use your own institution-centric examples and gather them and make sure as leaders you propagate them, you fuel them, you make more and more of them possible. That's my answer to what we all can do when we go home. Let me give you a couple of my favorite examples. After learning of Muhammad Yunus's work with Grameen Bank and meeting with him in person, a Wharton alumna, Roshana Zafar, returned to her native Pakistan and started the Kashf Foundation, the country's first specialized microfinance organization. Through Kashf, women from low-income communities have access to loans and to insurance. Since 1997, the foundation has worked with more than 1 million families, providing very small sums of money to enable economic growth. In turn, this growth has enabled families to send their children to school, generating a virtuous cycle of education and advancement. Awareness and action, those are two critical factors of the global women's movement. But they are not enough. And because they are not enough, gives us a clue to why universities are so important. Assessment is also critical. We must determine which efforts produce the most significant change and the most sustainable outcomes. We want change in outcomes that jump over that tipping point so there is no turning back. Three of the most effective paths to empowering women to improve the world, this will be no surprise to you, are improving health, reducing poverty, and increasing access to education. Now let me focus on better health. Better health for women and girls improves educational outcomes and decreases poverty. Excellent evidence to that effect. Interventions that promote health education, that prevent disease and injury, and that increase access to health care have a tremendous demonstrable impact in communities around the world. So, how can we improve women's health in the 21st century? Just as Adams did a century ago, we need to demonstrate the connection between women's rights, health, and urbanization, which is where most women and men, girls and boys live. Currently, more than half of the people on the planet, an estimated 3.5 billion women, men, and children, live in urban areas. Over the next 2 decades, the world's cities will grow, eventually supporting a staggering 5 billion people. The challenges posed by this surge are enormous. Will our cities buckle under the strain of ballooning populations? I just came back from Shanghai and Beijing, and it is simply mind-boggling how fast those cities have grown and how large they are. Any of you who've been in Mumbai know the same is true, and they're with a very young population. Will those cities simply buckle under the ballooning populations, or will we work and develop systems that meet the most basic needs? Unpolluted air, clean water, sanitation, food, and decent health care. Because women face far fewer employment opportunities and assume greater responsibilities as caregivers, they are at special risk of bearing the most costly burdens of urbanization. To improve the opportunities and life choices of urban women, we need an effective coalition. It must be a coalition of researchers, clinicians, educators, and community advocates who identify the most effective policies and then push for significant policy changes in our world cities. We need more employment opportunities, equal pay for equal work, improved prenatal and postnatal care, child care for working women, and high standards of education for all children. For these policies to become a reality, we also must educate the next generation of leaders. Young women and men who today are broadly educated and engaged in the movement to empower women and improve the world. They will fuel tomorrow's progress. So, the neglected news, which I bring to you, and it should be a banner headline, is that record numbers of college students today are ready to get involved. It should be a banner headline because I could not have broadcast that news as recently as a decade ago. There is excellent evidence from all kinds of surveys that college freshmen today, 69% of them, say that helping others in difficulty is among their highest priorities. This is no longer the me generation, and we had better recognize that, because we will lose the greatest opportunity to educate and empower this generation of young people if we do not fuel their desire to improve the world. Now, 3 out of 10 students wish to satisfy that priority by volunteering or participating in community service activities. And that's too low, but it's the best foundation we have upon which we can build a better future. Here at Penn, more than 4,000 of our 9,600 undergraduates every year engage in sustained service activities in addition to their academic studies. We have, among the selective universities, the most robust and successful academically based service learning courses and volunteer system. And I'm talking about sustained volunteer activity. In recognition of our local engagement efforts with the city of Philadelphia, we were recently named the #1 best neighbor among American colleges and universities. Thank all of you at Penn for doing that. Many school children in Philadelphia and other major cities in the U.S. and around the world have very limited access to nutritious food, to health care, and open spaces. Penn's Agatston Urban Nutrition Initiative provides educational programs in 20 public schools and empowers elementary and high school students to take control of their health. Students who go through the program, and this is the most important fact from the institution's perspective, our students who go through the program often become nutrition advocates in their communities. So it is not only a direct contribution to Philadelphia's school children and their families, but there's a multiplier effect. These students become the leaders who will bring these means, effective means, of making a difference to their own communities. Our commitment to empowering women to improve the world begins right here in Philadelphia. In fact, it begins right here in West Philadelphia, and then as circles expands outward. But we also have a commitment to local and global engagement, and our commitment to improve the world begins here but expands globally. And let me give you an example. The Guatemalan Health Initiative has empowered Penn students to explore the effects of undernutrition on pregnancy. Under the direction of a medical anthropologist on our faculty, a Penn junior constructed her own research protocol, tracked the weights of pregnant women in Guatemala, and investigated the major factors that shape their attitudes about nutrition and the connection of those attitudes and the resulting behavior on fetal health. The empowerment of young Penn women empowers Philadelphia school children and their parents and expectant mothers in Guatemala. And those are just two examples. These are two of thousands of ways in which Penn students are working to empower women and improve the world before they graduate. Imagine, just imagine, what could be accomplished if we unlocked the potential of all university students who are interested in empowering women to improve the world. That is not only a vision, but it's a realizable vision if universities get behind it. Jane Addams reminds us to reinvent our approaches. We need to recognize that the pressing challenges posed by urbanization on the lives of women and girls are lifelong challenges, not only to individuals, but also to institutions. It's too easy, and it would be too easy for me to stand up here and talk about what individuals can do, when the fact is institutions, and the institutions that we lead and are part of, and there are really hundreds of leaders in this, at Penn and in this audience, we have to focus on what our institutions can do to empower present and future leaders to help women improve the world. And you help them by empowering them. We need to recognize that the pressing challenges are not only lifelong challenges, but they're challenges to institutions and individuals alike. Universities must broadly educate the next generation of leaders, men and women alike, and I welcome not only Michael, but his whole gender to the task. Yeah, and we must be models of engagement with local and global communities. We must identify and support the programs that demonstrate the best results. Now, you wouldn't think I would conclude this talk without referring to Penn's founder, Benjamin Franklin, who was not very good on the women's issue, I should say, but he wrote some wise things that can be and are still applicable. Writing in 1786, he observed with concern how long a useful truth may be known and exist before it is generally received and practiced on. What we at Penn have learned from our founder is that it's not enough to know the truth. It is very important to know how to put it into practice. The useful truth that we need to disseminate is that when we improve healthcare, education, and employment opportunities for women, they drive their families, their communities, their cities, their nations, and the world forward. There is great evidence that demonstrates that. We need to make people aware of that evidence. We need to make people aware of the urgency of recognizing that, the urgency of acting, and the importance of assessing our actions moving forward. It is our increased awareness, our increased access to these opportunities, and our hard-headed assessment of what works best that will drive the movement, an historic movement that empowers women to improve our world, not just on the margins, but at the core, with healthcare, with education, and with employment for all. I thank you for joining in this cause and for being part not only of the conversation about the problem, but also of the solution. Thank you very, very much. And I welcome questions and comments. So the question is, in some societies, the issue of raising the issue and pushing the issue of women's empowerment backfires because it's thought to be all about women, whereas if you put it, as I put it, that it's also about helping men and women alike, then it resonates. Is that a fair? Okay. So let me distinguish between two things. One is the way you talk about the issue, and whether you talk about women's empowerment or you talk simply about making education, job opportunities, healthcare available to everyone. So that's one thing. And the way you talk about it, I think, has to vary with your audience. But the second part is what really works as far as public policy. And there I will not, and I think we should not retreat an inch. There is tremendous evidence that if you want to efficiently and effectively improve the conditions of boys and girls, men and women alike, you must start by empowering women, because they are the primary caregivers of boys and girls, and if they don't have good health care, and if they don't have opportunities to earn money, their children, boys and girls alike, will not progress. And that's the evidence that comes from whether you look at what Muhammad Yunus is doing in Grameen Bank, what the World Bank, what local microfinance has been able to do. All of that evidence is now compelling, and that's why I added the assessment as an essential part of it. And I see you nodding. That's really what we can't retreat from. That if you want, as we have to, use our resources wisely, you have to focus on, for example, maternal health, as one of our students in Guatemala is doing. Here. In Bangladesh, they now have excellent facilities for women to use for maternal health, but they're being underutilized. And can the Penn partner and find out why in order to make the utilization further? Well, that's an excellent example of my assessment point. I don't know what the answer is whether we have the capacity to partner with you on that, but I do know that those are the kinds of issues that we have to wrap our minds around and that really bring together what an educational institution like Penn wants to do to educate our students and what a lot of our faculty are interested in and what would drive this empowerment forward. And it's all too easy for faculty and students alike who are not involved in actually doing these kinds of on-the-ground studies to imagine if we build the facilities, of course they'll be used, and that's often not the case. And indeed, both of these questions raise a really difficult issue that I hope this conference will tackle, and I know that a lot of our faculty are tackling, which is how do you deal with the kinds of cultural differences that really affect what kinds of policies will actually empower women to improve the world. And there is no doubt that we have to take those into account when we think of what really works. And one of the things that I'm very excited about, when I say that I'm excited and energized by this set of issues, I mean it in the action sense. I am one of 5 university presidents who have created a forum called the Global Colloquium of University Presidents. And we meet once a year with the Secretary General of the United Nations. We began by meeting with Kofi Annan, and next we now are meeting with Ban Ki-moon. And the Secretary General basically wanted to have this forum so the United Nations could partner with the great universities in this country and around the world to tackle the most important issues facing the United Nations and countries that university presidents and faculty have something to say about based on really excellent research. And so this will be, this coming year, 2011, it will be Penn's turn to host the Global Colloquium of University Presidents with the Secretary General. And I get to choose the topic. And guess what the topic will be? Empowering women to change the world. That will be our topic. And the great thing about doing that with the United Nations is that we will have university presidents from all of these different countries, which represent real significant differences in economic development and in cultural perspective, to discuss this with the Secretary General. So I'm very excited that this group will give me material to move on and hand over to the Secretary General, who I'm very proud to say takes this as one of the most important issues for the United Nations to tackle. Yeah. There's a very good generalization that comes out of what you say, which works not only at the community level, but all the way up through politics. An American president, Lyndon Baines Johnson, was famous for saying this, when it's very applicable to what just happened in American politics. People thought that President Obama had made a dreadful decision in letting Congress have so much say about health care reform. It went on, and you know, it almost failed, but it did succeed in the end. And it succeeded in the end because he could get the votes through Congress. And what LBJ was famous for saying is, if they're not with you at the takeoff, they won't be with you at the landing. And, you know, and that is something really important for those of us who want and are committed to empowering women. You have to, as you've said, work with communities from the inception so they really have some, you know, as we say, skin in the game. They buy into what you're doing. So that's really important. And I think the fact that there's a cross-cultural aspect to this is really important. Yeah.
Including teaching policymakers and providing them with excellent evidence to ensure that there are evidence-based policies.
Right. So there are different kinds. Oh, you want to repeat the question? Okay. How do we get researchers involved in advocacy so policymakers know what works and don't just do whatever has been done in the past. So how do we get researchers involved in advocacy? That's a really important question for university presidents and deans and faculty members to answer, because there is a line which if we cross, we cease to be objective researchers and we become politicians. And we like to educate politicians at the University of Pennsylvania because we believe it's a very noble calling, but we ourselves can't be partisan politicians. So how do you then get the best research into the hands and into, you know, get the ears? As I said, we want the ears of policymakers. Well, let me give you an example, a personal example. I was asked recently to chair President Obama's commission for the study of bioethical issues, and I was honored to accept that invitation, but it's not my day job. My day job is running the University of Pennsylvania, and so I had to ask myself, is it not only consistent with being president of Penn, but would it further our mission as well as be of service to the president? And the answer was yes, because of what my answer to your question, which is it would help get the best research into the hands of policymakers who are committed to moving ahead in healthcare and issues that have to do with science, medicine, and technology. And that's at a very high level of a president's commission, but we're going to be asking researchers to testify before the commission. I did a listening tour in Washington where I asked the heads of all the agencies of NIH and the Food and Drug Administration and Human Subjects Research and organ transplantation to tell me what are the questions that they would need answers to. And then I'm going to ask policy experts, academics, to help give us the answers to those. We haven't, you know, the commission isn't up and running yet, so we haven't picked any of those issues, but all of the issues that we pick, we will pick because there's some important academic research being done. And I think individual faculty members not only can, but many of them do this all the time. They ought, because everything we publish is open access, and they really help inform policymakers. So I would say that Penn is in some sense a model of this because we have so many faculty members who are engaged in not only policy relevant research, but who will go to Washington, talk to policymakers, and really make a difference in the kinds of policies moving forward. So how do you deal with all of the different variables that affect what you can do? Let me take an example that I know fairly well from that's a totally thought to be and is a very different culture than the American culture. In the United Arab Emirates, there are now major universities that are led by women, that have a majority of students who are women, who are going to be among the most educated people in the Muslim world. And that's going to change the culture of that world. So I think it's really important for those of us who believe, as I do, that you have to take different cultures into account, not to freeze cultures in time and assume they can't change. And so I think working with, this goes back to what that young woman up there spoke about, which is working with members of the community in doing programs is very important. And I think that we can't think of this as a purely, I talked about how institutional programs are very important, but when I do that, I think it's also important to say that this is not a top-down process, There are many, many grassroots institutions. The University of Pennsylvania is one of them. We're a private university. We work with our community. Everything that we do with different communities at home and around the world is a partnership. It's a collaboration. If you do policy making in partnership and collaboration, you are much more likely to succeed. And that's what I meant by they have to be with you at takeoff if they're going to be with you at landing. I mean, you have to, from the beginning, work with people who are part of the culture of the society and the communities that they want to change. But you have to be, find the people who want to change, because policy by its very nature, programs by its very nature, education by its very nature is about change. There is no way that young women who are being educated in the Muslim world are going to be satisfied with the world as it is, any more than young women educated at the University of Pennsylvania are going to be satisfied with how our world is, our society is. There is just too much that's important to change, and if education is worth anything, it's worthwhile, not only for its own sake, which I am a big believer in. I mean, I love to curl up in bed and read a great book, but what really gives us as universities a right to exist, we're not like human beings who have a right to exist. We have a right to exist only if we earn that right, and we're educating people who are going to lead the world to make a difference. And that, I think, is, you can see it as a difficulty and a dilemma, that there are lots of different obstacles, political, cultural, and so on. I see it as an energizing challenge. It is great that there are different cultures around the world. It's unfortunate that some of them, indeed all of them, have limited women's rights, but that's the challenge. Let's go out and change that. Half of the educated world in many societies now, including the Emirates, are women, more than half. That's a very hopeful sign. And we have lots of partners in men as well. And indeed, all of us who are married have men who support us. I don't mean economically, I mean support the fact that we have careers. And when girls ask me how I did it, I talk to them about my career, but I also say marry well too. It really helps. That may be politically incorrect, but it's true.
Thank you.
Right before I came here, I was with the Secretary of Health and Human Services, Kathleen Sebelius, who was speaking at this conference that brought together advocates of community schools. And here's the kind of policy that brings education and health together for young children. We have at Penn urban nutrition initiative at a local community school, the Sayre School, which brings education and health and nutrition together, not only for the students, but for the families. And policies, we now have a government in Washington that's very favorably disposed towards supporting these kinds of community schools. To get children when they're young to have excellent health care and education is the first step to getting, as you said, students all the way through university. If you fall behind, if you're behind in third grade in education and you don't have adequate health care, it is extremely difficult to catch up. Some kids, there are exceptions to everything, will do so, but we have to begin with policies that target health and education for all children. And that's girls and boys alike. There's no difference there. Afaf Melis, Dean Melis, would you please take the microphone? I know you're shy, but is there a microphone for Dean Melis?
President Gutmann, we have a group of high school students here, men and women in the back, and it would be wonderful if you just direct a bit of advice, especially for them, and acknowledge them. They are right there, sitting there. So
They're
what would be your
Philadelphia
advice?
high school students?
Yes.
Well,
Actually, are from Shamokin.
yes.
Oh, sorry.
And Cheltenham High School and also Auden Reed, they are competing for the top 3 videos on women's health that we will see later tonight, and the winner will be announced. So they're all here waiting.
So my advice to you is to dream big, get a fabulous university education. If you can get into Penn, all the more power to you. But seriously, really know that what you've made in those videos is a great start, but it's not enough. You really need to get the best education and then get the most satisfaction out of life by really figuring out what you can do to improve the world. And just as, you know, it is, so when this is going to sound like your parents talking to you, but when I was a girl, I couldn't have imagined the possibilities that are now open to women. But now, I think young men and women alike really have the capacity, through all the knowledge you have that we didn't have, to use the new media, like the videos, post them on, let's get them on Facebook and YouTube and Twitter, to use those to connect with lots of other people, young people, who really want to make a difference. And this is not parental advice that I'm going to give you right now. It's professional advice from my study of political science. Don't expect that everything comes quickly. I told 2 years ago the graduates at the University of Pennsylvania, before the historic election of 2008, that whoever was elected, whether they were in favor of Hillary Clinton, Barack Obama, or John McCain, they were going to be disillusioned after the election, that the promises, the hopes, the change would be a lot slower than we all wish. It is our frontal lobes, our brains, that allow us to persevere through tough times. You are our best hope for making the future better, and you should use that media for long-term change. The short-term gratification is easy. It comes and it goes, but long-term change is what will really make a difference in your lives and the lives of your children. So I end by saying thank you for participating in our video conference. Thank you very much, everybody. Thank you.